In the application of shortwave diathermy, the TheraTouch DX2 offers two key proprietary features that separate it from the competition. The first one is dubbed heat, which is high efficiency auto tuning. This auto resonance tuning allows us to maximize the energy transmission without higher output. It also allows for the device to tune faster to the target area, approximately 5 minutes faster, which allows for more treatments throughout the day. The second feature is called SDC, or Scientific Dosage Control. This allowed for the creation of 2 additional thermal dosimetry programs as compared to our competitors. This allows for better titration of the dosage to maximize the amount of heat delivered to the area depending on the size of the patient, maximizing the treatment and the outcome delivered. It also allows for better control in the lower dosaging, which is very important. It allows us to then create the microcirculation programming that we now offer. To further show the value of the scientific dosage control system, please see Table A. Table A shows you the conventional normal dosaging for shortwave diathermy. You'll see dosage 1, 2, 3, which is moderate heat, and then dosage 4, which is vigorous heat. And again, with the advent of the scientific dosage control, if you look at Table B, you will see that the average output wattage-wise between dosage 3 and dosage 4, there is a big gap. And by identifying that gap, we are able to realize that there is a need for 2 more dosages. And that's hence the creation of dosage 3B and 3C. It allows for better titration from the moderate heat component or dosage, and allows us to titrate because of different patient variants in size, adipose tissue, the amount of lean muscle mass. It allows for a better titration of that patient, allowing for a better treatment and a better outcome. When you look at graph A, you will see how that dosages vary, and you can see that by having that control mechanism, we again deliver a much better shortwave diathermy treatment. Remember, before you start treatment, to deploy your interference, RF interference sign on the door to let people, outsiders, know that you're doing a diathermy treatment and don't accidentally surprise you and walk in on you. This is located, in case you don't have a copy, is located at www.richmarweb.com. And if you go to the products page for diathermy, you'll see a PDF copy of this signage. Now we're ready to apply the TheraTouch shortwave diathermy to the patient. Some considerations in regards to things you should have ready to go when you're set to deploy the device. The first thing you'll need is a nice soft cotton towel. If the patient's wearing clothing, make sure it's cotton-based versus any type of polyesters. Polyesters are known to react with the diathermy heat and possibly create an adverse heat at the fabric level versus transmitting through to the skin. Just place the towel over the area being treated. The reason for the towel is predominantly because if the patient does perspire, that perspiration would probably heat up faster than the tissue itself, creating small little burn area. So again, that's the idea of the towel is to sop up that moisture. Now we're getting ready to deploy the induction drum into location. Again, one of the proprietary cool things about our device that separates us from the competition is this articulating arm. It has got 3 pivot points as compared to our competitors that use 2. We have a little bit shorter lever lengths that allow for strength of placement, so less chance for movement during treatment. It'll stay in place for you. When you look at the way it's built like your shoulder. So we loosen up the gray knob here. Make sure you do have control of the arm because it will drop down based on where it is in position. You don't want this to drop down and actually hit the floor, breaking your drum, and that won't be under warranty. So again, the arm does abduct and flex and extend inside. So you have the ability to set your location and get that to where you need it to be. You have an elbow joint, very similar, that we can lower this down, and then this acts like your wrist, which it again flex, extends, and supinates and pronates, so we can get this in a very good location. Make sure you lock all positions. The other considerations for treatment are going to be make sure that there's no wearable metal on the patient. We might again check for earrings, any type of necklaces, any wearable metals. We want to make sure the towel is in place, and check also with the patient with the records for contraindications. Make sure the patient doesn't have any implantable neuro devices, pacemakers, again, any type of implantable metal, and again, they're not pregnant. We'll make sure you do explain to the patient the desired result of a shortwave diathermy is to have a good warmth, but it should never get too hot. And you got to remember, the point of the patient feedback is the critical point of stopping a treatment. If the patient is to get an adverse sensation and it gets too hot, it overrules all dosaging calculations or anything else you're doing. You would then stop treatment. When we set up the device, you want to make sure, again, you keep in consideration the location of the device, so that, again, the patient switch can be handed to the patient, and they have an easy way to pull to deploy the safety switch. When you start up the device and we go into thermal dosimetry, press start. You will then see on the display here, there's a bar graph telling you how well you have it located in regards to the patient's treatment site. And also you'll see when we deploy, it's ready, an LED deploy on the induction drum. Press start and then ready to go, and hit play.